Greetings. Today, November 14th, 2022, is World Diabetes Day. We will be discussing diabetes awareness. My name is Cassandra Shaw. I am a certified health education specialist with No Struggle, No Success Youth and Adult Reentry Program. According to the Center for Disease Control's National Diabetes Report, nearly 4 out of 10 adults in the U.S. have been diagnosed with diabetes. Many people many people have diabetes or are pre diabetic and have yet to be diagnosed. Diabetes is a very serious illness, and everyone should be aware of the possibilities of it and making sure that you see your doctor regularly to check for diabetes because it has happened to a lot of people. We all know someone who is affected by diabetes, and awareness of this disease is very necessary for the health of all of us. Type 1 diabetes, you may have heard of, it usually onsets in childhood, yet it can happen at any age. And there has currently been an increase in kids with type 2 diabetes, some as young as 10 years old. And this is closely related to the increase in childhood obesity. Type 1 diabetes is an autoimmune disease. It's called juvenile diabetes, like I mentioned, because it's often diagnosed in children and teens. Yet in people with type 1 diabetes, their immune system, it mistakenly attacks the healthy tissues of their body and destroys the insulin producing cells in the pancreas. The result is their body does not produce insulin and it does not process sugar properly. Type 2 diabetes is the most common form of diabetes, and it means that your body doesn't use insulin properly. And while some people can control their blood glucose levels with healthy eating and exercise, others may need medication or insulin to help manage it. So either their body does not produce enough insulin or their body does not react to the insulin. Warning signs of diabetes could be fatigue, slow wound healing, like if you get a cut and it takes forever to heal, pain or numbness in the hands and feet. And then some symptoms are mild or they just go unnoticed. You may not even notice it. People with type 1 diabetes may also have nausea, vomiting, or stomach pains. And type 1 diabetes symptoms can develop in just a few weeks or months and can be severe. Sometimes it can be in children. They can have a sugary smell to their breath or to their urine. That's a sign of diabetes as well. Type 1 diabetes usually starts when people are younger. That's a thing to remember usually, but it can happen at any age. Type 2 diabetes symptoms are very similar, either no symptoms, mild symptoms, or they are unnoticeable symptoms, or there's fatigue, slow healing, pain and numbness in the feet. And they often take several years to develop. Some people don't notice any symptoms at all. And type 2 diabetes usually starts in adulthood, though, as I mentioned, more and more children and teens are developing it because sometimes the symptoms are hard to spot. It's important to know the risk factors for type 1 and type 2 diabetes, making sure that you're visiting your doctor regularly. And if you see any of these warning signs, making sure that you're keeping notes of that and letting your doctor know at your next visit. Gestational diabetes is diabetes during pregnancy, and oftentimes there are no symptoms. And this is why that if you are pregnant, that your doctor should test you for gestational diabetes between 24 and 28 weeks of pregnancy. This test is a part of your prenatal care. So make sure that you get this test done at 24 and 28 weeks of pregnancy. If needed, you can make additional changes to protect your baby, being that changing your diet and making sure that you keep your stress levels low. If you are smoking, not smoking anymore. During pregnancy, you can help control your diabetes through healthy eating, your exercise, and if necessary, you can also may need to take medication to support. You'll also need to check your blood glucose levels, and controlling your blood sugar will be the way to help keep you and your baby healthy and safe and prevent a difficult delivery. Generally, your blood sugar will return to its usual levels soon after delivery. But if you have had gestational diabetes, it puts you at risk, a higher risk of getting type 2 diabetes. So you'll need to stay on top of that and get tested regularly for changes in your blood sugar and maintain a healthy lifestyle. Healthy living usually includes exercise, a healthy balanced diet with lots of fruits and vegetables and grains. If you need to take vitamins to supplements are very helpful as well. Making sure you're checking your blood glucose level, you're visiting with your doctor, doing some type of exercise that is fun for you. There are so many different forms. Finding the thing that fits for you will be the most beneficial thing to keeping your body healthy. People with diabetes are also prone to other health risks like high blood pressure or eye problems, heart disease, stroke, and kidney disease. See your healthcare providers regularly, twice a year or more. You want to see your eye doctor, a foot doctor, and a dentist at least once a year or more if you have any eye, feet, or gum or teeth concerns. But regular health care will help you stay healthy. So it's important, especially if you have diabetes, to make sure that you see your healthcare provider twice or more a year, your eye doctor, your foot doctor, and your dentist at least once a year or more if needed. Your regular health care is super important. So you can always ask to stay on top of it, to set up your next visit before you leave the office, to make sure you put a note in your phone to remind you, or ask for a reminder call when your appointment is coming up, because you definitely need to make sure that you're building that rapport and have that communication with your healthcare providers, that you can call them if you have any questions regarding your diabetes or if you have diabetes symptoms. You can manage your diabetes with your healthy lifestyle and with your medication management if necessary. Here are some additional diabetes resources. There are diabetes groups that you can access through dhs.gov, diabetes.org, and the cdc.gov has a large amount of different diabetes resources. In addition, for your healthcare, November is open enrollment month. Please make sure that you are signing up for your health insurance if you don't already have it, or if you need to change anything with your current health insurance, now is the time. In addition, if you want any more diabetes information, you have any questions, need to get connected to a healthcare provider, you are able to email me. Again, at health@nostruggleноsuccess.org. I appreciate this time and space with you. Have a great day, and please take care of yourselves and others. Be well.